Welcome at the podcast for the future of health. Conversations about innovation, technology, change, but most of all about people in health. This is not again a podcast about money or efficiency in processes. If that is your cup of tea, you might want to find another podcast. Dr. Louise Schaper is an innovator and change agent who doesn't sit still, and whose passion and enthusiasm for health informatics is shaping a new future for HISA, the Australian digital health community. Her appointment as CEO came on the back of 10 years of experience in and applied passion for health informatics. With a background as an occupational therapist and a PhD on technology acceptance amongst health professionals, after a 24-hour flight because she invited me to her conference in Melbourne, I sat down with this powerhouse. And this is what came out of it. So good morning, Louise.
Good morning, Lucian.
Sitting in Melbourne, down under for me, was a great trip coming in.
Excellent. I should say g'day, shouldn't I?
Yeah, good day. I'm going to try that one as well, yeah. Can you tell me a bit about yourself? You're running, as one of the things that you do, you're running this great conference over here. But why do you do these kind of things, actually?
Why? Yeah, I wouldn't know anything else to do, really, to be honest. So my name's Louise Schaper, and I'm the CEO of the Health Informatics Society of Australia. But what I'm about is actually impact and influence. I'm trying to fix healthcare. I'm one of thousands of people trying to fix healthcare. And if I can have platforms, and thank you for inviting me onto your show, because that's a fabulous platform, it's where we can actually be impactful and influential for others and helping grow this army that we need to fix healthcare, then that drives me. That's what gets me up in the morning.
Yeah, and for how long are you doing this already?
Well, I have been doing my current paid job for almost 10 years. It'll be 10 years in a couple of months.
Wow. And prior to that?
Prior to that, training-wise, I trained as an occupational therapist, and then I ended up doing a PhD in health informatics. And on the day that I handed in my PhD, my plans were to take a break. I hadn't slept much in the previous 3 months, and I bought novels and some DVDs, because it was back in the days of DVDs.
Yep.
Before we streamed.
We
movies.
Still know them.
Yes. Anyway, and that was my plan, to actually take a bit of a break. And instead, within weeks of handing that in, the CEO of HISA job came up, and someone suggested I apply for it. And then 2 people and then 3 people suggested, and I thought, maybe I should give it a go. And there you go. 10 years later, I still haven't had that break.
The novels are still waiting for you?
Yeah, well, I started investing in Audible books. So
tell me about Audible. Indeed, that's also one of the things I like very much. I like podcasts, but what's your flavor of getting these Audible books? Is it in car? Is it in planes? Is it during your workout?
It's sort of everywhere, yeah. So I must say I'm a huge fan of all the people who bought us these mobile devices and headphones and the Bluetooth headphones. So basically I'm always multitasking. I feel like I'm wasting my time if I'm only doing one thing at a time. So it means when I'm doing the dishes, doing the ironing, going for a run, driving, I'm always listening to something. And I also use it to go to sleep. So
you fall asleep during reading the book?
Yeah. So we're listening. Yeah. So I have this disorder, I'd like to think, because that I have trouble turning my brain off, and yet if I'm really tired, I'll fall asleep watching television. And so I thought, well, why am I able to do that? So now what I do is because I'm always thinking about what's next and what am I doing tomorrow, and anyway, so now I put on a lecture or an audio book and just press play, and I let it run for about 15 minutes, and 5 minutes into it, I'm asleep. And then I just pick it up, rewind it.
And you find yourselves waking up with headphones on?
Sometimes I do, yeah. And if I'm sleeping on my own, then that's better because I don't have to use headphones.
Yeah, of course.
Sometimes the headphones are all throughout the bed. I have to find them in the morning.
Yeah, so is that also a bit of a narrative of the things that are happening in healthcare IT right now? More and more using stuff that's available remotely in different places to be delocalized? Is that something also that has a resemblance between what we are doing with podcasts and listening to audiobooks indeed. Where is this going?
Oh, well, I think the real shift is that in previous years, in the previous 20 years, and longer actually, there has been the impact of technology in healthcare. Actually getting electronic health records into hospitals. In Australia, in the 90s, like before the internet, we had 98% of our GPs, general practitioners that is, using technology to manage their clinical information. So, but in the past, and this is where the real difference I see, that in the past it's always been about the application of technologies that exist in other sectors or for other purposes to healthcare. What digital health and what really excites me, and I think we're just at the start of this journey, is now we're talking about healthcare in a digital world. And that is a very different concept, and what it can achieve and what that means for clinicians, and especially what it means for us as patients, as consumers, game changer.
Yeah, well, totally agree with that. One of the things that I also see often is that people talk about e-health. And I think it was fine for, let's say, the last 10, 15 years, that it was something special, that some group within a hospital or otherwise would work on that specific topic, like it also was with quality within healthcare in the early days. But now it really should come as a standard feature of healthcare, and it's just healthcare, I think.
Yeah, wouldn't that be wonderful? How long is it going to take? I mean, we have to be patient with these things, but yeah, it should, because I remember, I'm not that young. I do remember that when the internet was invented, and we had e-business and e-commerce, and they were terms that, if you're in your 20s now, you wouldn't think we actually used them, but we did. But not for long, a year or two, because then business actually went, well, hang on a minute, this is actually the way that we should do business, and so they dropped the e off, and it just became business and commerce. And it's just banking. We don't do e-banking, and healthcare's got a while before we get there, but we will.
Why is that, you think?
Why is it taking so long?
Yeah, why is it taking so long in healthcare?
Yeah, it's a lot harder. So in most other industries, banking's a good one to use. Banking is so simple by comparison. So, Lucian, you and I are from different continents, and yet I'm pretty sure I could understand how banking works in your country, and I'm pretty sure you could work it out how it works here. It's the same thing. It's like, I have money, it needs to be stored somewhere, I need to access it. It's numbers, it's bytes, and anyway, it's very easy, right? It's sort of a binary thing. And healthcare, every single person is unique. Every single system is unique. And so structured data is one example, for instance, and it might be a bit boring, but if you think about it in banking, it's like $100 is £100 is €100. I mean, we sort of got an idea of money, whereas the language that we use to describe healthcare is so critical to get right, but there's lots of different words. Like there's about 7 different terms that mean heart attack in English. And so if you're programming a computer to actually understand those 7 different terms just in English, let alone other languages, how do you do that? I mean, that's very basic. There's, people here that would say there's a lot more technical things, but it's a lot harder problem to solve. What we're trying to solve is a wicked problem here, and it's one that takes a village to do it, because the problem is not a technical one. It is with people and with systems, and we're all unique. Sorry, that's a bit rambling answer.
Yeah. I always like to think it's about culture.
Yeah.
Yes, we're from different continents, but anatomically, mankind is pretty much the same in Europe and then in Australia. The majority of the physicians have been trained in the same way. They're using the same language to describe problems with your body, and yet in the IT fashion, we kind of dissected it in, again, different systems that have to talk to each other and indeed use the same words and definitions for it. Why is it that we've kind of diverted so much from the original ones? Because I think that if you put a physician from Italy at the table tonight with some from New Zealand, they pretty much be able to talk about their specific speciality with no problem at all.
They would. But would they agree on how that information should be captured how it should be shared, who should own it. I mean, these are these cultural problems or these cultural challenges, and it's something that there's not many countries that can mandate these things, and how the decisions get made is quite complex. So no, I completely agree that.
So it's more of the governance kind of aspect.
Governance comes into it a lot, absolutely. So there is, it is a more complex problem.
Yeah. So it takes a village. What kind of village does it take to get these things up and running? What's the power pill, the power boost that if you would wake up in the middle of the night after falling asleep with your Audible book and all of a sudden now I got this magic wand, what would you do?
Well, firstly, you'd start with how, to that culture problem, how you educate people. So when and look, there are pockets of innovation in this space around the world, and including in Australia. But generally, doctors, nurses, occupational therapists, all the clinicians that are so important to delivering healthcare and who we trust and rely on, they're not taught these things at university.
And they're not trained together, by the way.
They are not. No, they're not. In Australia, we've done a bit in getting our allied health people trained together. But no, so they're taught that, generally speaking, that the information that you're collecting about a patient who's sitting in front of you is for your purposes. So whether you're an orthopedic surgeon or you're an occupational therapist, you're collecting that information for your own purposes. You're not thinking about how that information could be useful to others in the clinical care team, and especially usually not for the patient. I mean, now these things are changing, and you certainly see a lot of people really understanding that shouldn't no longer be the case. But if we're looking at where to start, I'd be starting at, if I could change everyone's perspective straight away, it would be that the information that you're collecting, you don't own it. It's not for your purposes. It's for the collective good of that patient sitting in front of you, and it includes them. And so it needs to be captured and accessible, all with appropriate security protocols, of course, and privacy protocols. But it needs to be captured and shared in a way that is going to actually enable improved patient outcomes, and that is not how we're trained to collect clinical information.
And is that also something that's happening right now where, let's say, new players, Apples, Amazons, are stepping into the arena and say, we're able to get that data at one place and you could use it, you could start to share it with all the rest of the information that you also share yourself? Is that one of the power boosts that is going to push this?
It could be. It could be. I mean, those two companies you mentioned, I think that they will actually. But they've got their closed doors at the moment in terms of what they're working on, and there's whispers around. But, you don't get someone who's as successful in business as Steve Jobs was running Apple, as Jeff Bezos is running Amazon, even though he's a lot poorer than he was a few months ago. Poor Jeff. But, you don't get people who are that successful at business in disrupting markets, making serious plays for the healthcare sector. I mean, Jeff went and hired a tool, Gwandi. Again, there's no way he would have taken that job if it was just another job. He didn't need that job.
Absolutely.
So what they could be doing there could be real game changers. And look, and the thing is too, one of their significant, no matter what ends up coming out of those powerhouses, as you call them, they're going to come direct to you and I as individuals, as consumers of their products, of their systems. And people and we're already familiar with them. Whereas, of course, the current players in the healthcare system, we're not their target market. They sell to hospitals, to large organisations, and in Australia to governments. So that very change in business model and business practice will, I think, it could be a real game changer, and it's certainly really interesting. You want to watch this space.
I also like to think a lot that the user interface that these companies put front and center to consumers. And I'm the last one to say that a patient is a consumer. A patient has consumer aspects.
We use consumer.
Is it?
Yeah, we do. And we've done it for a long, long time, before digital health. Yeah, so I know it seems, so we don't like the word patient because patient, just generally speaking as well, so patients mean that, you're vulnerable, you have things done to you by people who know better. There's this whole medicalisation. So even in Australia, we talk about healthcare, we very rarely use the term medicine. Even the conference that we're at is health informatics. In America, America they call it medical informatics, and in Europe it's medical informatics, but in Australia we call it health informatics. So it's just a change in nomenclature slightly, but what it intends is quite significant. So just so you know, consumer is not a bad word.
No.
In terms of healthcare.
My reference also was to, like I said, the user interface. People are used to use technology, use apps on a daily basis, and they can order stuff at 10 a.m. and it gets delivered by 5, if not you're grumpy. And then all of a sudden you need to get in this healthcare space where everything's siloed. They're not talking to each other. And so I also hope that from these powerhouses, that is one of the aspects that gets brought to the table for all of us.
Oh, absolutely. And it's a real problem that globally, again, these are general comments I'm making, but, globally, clinicians don't like the medical record systems that they've been given to use. They don't like them very much. And in a lot of them, systems that came out of America were primarily designed first as a billing system. And so, and there are companies doing great things to improve the products and improve the interfaces, but they're a long way off for what consumers of today and just people of today expect, because we all now, I'm looking around at the table in front of us and I see 5 computers. No, I see 6 and 7, because you and I are also wearing computers and I'm sure we both have some more in our bags. So that was my point at the beginning. We're now talking about healthcare in the digital world, not the application of technology to healthcare. And so when we look at it that way, we are used to interfaces that just work or are pretty intuitive, and that's not how traditional IT systems are built. So it's certainly that, again, will be a game changer, I think.
No, and building on your remark on how physicians and nurses and other frontline staff like or dislike systems, that's one of the things I think about a lot is, with all the technology that's present, that they can use and that we have them to use, did all of us fail in bringing that in a proper way to them? In the Netherlands, like 40% of the total time that a physician or a nurse spends with the patient or consumer is entering data in systems. Like 6, 7 screens at one moment in time, up and running, and to copy paste. It's 2019. We
can do better than that.
We can do better. Is this due to the fact that the business models were different, that there was no good governance in it yet? Or why did it went astray, actually?
Yeah, and I wouldn't like to think that was a deliberate. I think people were just, they were built as one thing, and then other things got added on, and it was the best you can be. But and I would think that, yes, like you said, governance, it's really important to have the users of your products, and in this case of healthcare, we're talking about the clinicians generally. So clinicians need to be at the design table on looking at how systems are designed, because they also can bring something to the table that for a UX designer person who would not know, and that's that aspect of clinical governance and actually being aware of how systems need to be designed so that they also don't just not waste time and are unproductive, but that they actually don't unintentionally cause harm. So there's a whole field of e-safety around governance as well of those systems, and those there's going to be, actually we're going to hear from a UX expert at the conference as well talking about these things, so we're interested to see what he has to say.
So the HUX, the healthcare UX, should change.
Yeah.
Maybe?
Yes, definitely. And there is a lot of examples, unfortunately, of safety concerns built into the way systems. So it's not just clunky or they look unattractive and they're a bit of a pain in the butt to use. But there, for instance, there's it was quite a big case in Victoria, where I'm from in Australia, where a hospital, an audit was done of the IT system at a particular hospital, and discovered that the pulling up a medications list was too many clicks, right? So it was too cumbersome for the clinicians. So what the clinicians were doing is they'd bring up, Lucian's medical record, and they just pick the first drug that sort of came up. And then in Australia, you have to physically print a prescription on paper. It's this antiquated thing that is changing, but it hasn't changed yet. Anyway, so they print the piece of paper, and then they would cross out in a pen, in a biro, and write what the actual
on the
drug
paper
is. Yes,
go figure.
I know, and
but they're compliant.
Yep, but So the system they were, and like the thing is, like the clinicians who were doing that, that is not good practice at all. But they weren't doing that to try and cause patient harm. They weren't trying to do it to, put crappy data into the system. It was just, they're in a busy department. They're just trying to get through. They're trying to do the best. And that's one of the things that drives me as well, is because I really feel for clinicians that every single clinician I've ever met comes to healthcare with I want to do good and I want to help the planet and I want to help humankind and individuals as well. Like that's their mantra. And then they come in and they work in very pressured environments, in very pressured situations that most of us don't have to make those life and death decisions multiple times during a shift at work, but the frontline clinicians do. And so what I think is really important, if we can do better by giving them systems that enable them to do their job better instead of actually putting burden on them, and whether that's even using paper-based systems that they have to spend 30% of their shift running around the hospital looking for information. We can do better, and I do think in the next 10 years we'll see significant changes for clinicians in that respect.
So the next 10 years, your conference is about health IT. We're still talking about healthcare.
We are.
How can health IT help to push the needle also in terms of the preventional aspects, in terms of lifestyle changing?
Yeah.
Could you elaborate a bit more on that?
Yeah,
because I know you're working in that very field.
Yeah, well, I would see that that's a real game changer as well. So, and it wasn't I who first said it, but I quote this. I quote it in the public talks that I give, and it's fascinating. I always get the same reaction in the audience, and I just have a slide up there that sort of appears out of nowhere. It's not. I don't do a lead into it, and it just says in 5 years, the majority of clinically valuable information will not be originating from your clinical care records, like your traditional healthcare settings. Yeah. And I'm usually speaking to healthcare audiences and I watch all their faces and I do the dramatic pause and you can see them trying to wrap their head around it. And then I talk about it. And the thing is, look, maybe in 5 years' time I've still got that slide that says 5 years.
Yeah, sure.
But the point being is that traditionally where information came from is a patient sits in front of you, you ask them some questions, you write down the answers to their questions, and then you do tests inside your hospital or, your healthcare facility. The information comes back and that's what you're using to make your decisions. That's it. And we've seen in the last 10, 15 years that whole phenomenon of Dr. Google and people coming in with that and that's really, again, just a very basic thing, because now more and more people are collecting their own healthcare data. Now at the moment, of course, there's a big thing with us worried well, tracking our counters and looking at our Apple Watches to tell us if we're in our
We'll fix that as well. Yeah.
But this is just early days. Yeah. Like it's just early days. And what I think will be the game changer here is that these companies are recognising the value of having a consumer device that is priced at a consumer-based market, but it's medical grade.
And easy to use.
But with medical grade, so then clinicians won't be able to say, oh, well, who cares what your Fitbit says, or, as an example, that's not, but when it's medical grade data that they're getting in, that is, and in the easy to use, giving people just a spreadsheet of data isn't helpful, but well-designed dashboards with really critical information, that's going to be a game changer. And look, like for instance, my dad has significant health problems, and it's just a matter of time, I think, with him. Anyway, he's got so many. But recently, he went to see them about heart problems. Went to see his doctor, and he lives far away from me, so I don't get to say what happens. And he just rings me and tells me what happened for the day. And so the doctor did what they've been doing, they would have done 30 years ago when my dad went to see them with these complaints, and he strapped him up to this device that Dad has to wear for 24 hours.
Oh, yeah.
And I can tell you what my dad does, because this is not smart, but he thinks, he'll trick the doctor because he doesn't want to concern anyone, and he also doesn't want people to realise just how sick he is. So he won't move much. He won't go to the pub that night and have a drink. So he'll be on his best behaviour to try and make sure all his levels look good. I mean, this is his thinking, and then the levels will say what it is. But the next day, Dad will go back to the pub and do all those things, and
the phone rings again,
his sugars levels will spike because he will have a bowl of ice cream for dinner after the chocolate he's just had at lunch, all these things, right? So anyway, but it's like when I did, when I said to my dad, look, if I could get you a device, let's just watch, but it's actually going to keep an eye on what's happening in your health on a daily basis. Would you be interested? And he's like, oh, look, if you're happy for me to wear it, I'll do it if you want me to, honey. That sort of stuff. But at the moment, there's no way of me getting that information to his clinicians in a format that would actually be useful for them because their systems don't integrate, those sort of things. So, but in a few years' time, we'll be able to. So
yeah, because I think really some systems do. We've collaborated with Apple and Epic in 20.
Yes, that's not available in Australia.
Is not?
No. Not
Okay.
yet. Yeah.
Okay.
Yes.
But that's a matter of
time. But we'll get there,
yeah.
Yes.
Last question. Your conference in 2030.
Mm-hmm.
What's the main issue on the program?
Okay. Well, I won't be running it, but I'm going to be in the audience.
Okay, that's fine. It still will be a conference. It's like one of your kids.
2030. Okay.
Yeah.
So, hey, all right, we got another, just under over 10 years there. That's a great question. I would hope that we're no longer talking about the challenges that we'd be talking about now, like things like user design, interoperability, like these things that actually technically don't need to be problems anymore, but they are culturally. I would hope that we've changed the culture so much that we've actually moved on to conversations where it's just called healthcare.
Mm-hmm. Health.
Just called health. Just called health. And that's right. And we're talking about how we're actually utilising data to improve health outcomes and improve health and well-being at an individual level, at a population level, at a community level, and at a global level, because that's where all this stuff is going to go, and that's where it could get really exciting. So I'd hope that we're talking about those things, as well as, I don't know, will I be riding a hoverboard around the conference? Maybe. We're going to get jetpacks one day, aren't we?
There's this guy that crossed the channel with such a thing that at least have some
he was
looks of it.
He was crying at the press conference. He was so happy.
Yeah. Well,
so overwhelmed.
Good. Louisa, thank you very much.
Oh, thank you so much for having me on your show.
Thank you.
Bye.
Thank you for listening to this episode of The Future of Health. If you subscribe in your favorite podcast app, new episodes will come to you as soon as I publish them. If you liked it and have a spare minute, please rate this podcast and share it. I also would love to hear your feedback. Thank you again. Lucia Engelen, and at Transform Health and as an Edge Fellow at the Center for the Edge at Deloitte, I help institutions, corporates, governments and professionals with a soft landing into the future.